thank you for joining us. I'm Lynn, your host this evening. Tonight we'll be talking about eczema, a condition that affects thousands of families across South Africa. We were overwhelmed with the amount of questions we received. Thank you so much. The range of questions was vast, from causes and triggers to daily care, diet, treatment options, and how eczema affects babies, children, teens, and adults. Before we begin, just a quick note for everyone that will be joining us. Keep your eye on the comments because we'll be posting some useful links during the live. There'll be resources to help you find state allergy clinics, allergy professionals in your area, and information about Kiddie Calmwear. This is an allergy-friendly, dye-free, and latex-free clothing range that soothes and protects eczema-prone skin. There'll also be links to our AFSA-approved products, guidance on wet wrapping, and support, and our links to our support groups, the Atopic Eczema Support Group, the Food Allergy Support Group, and the Celiac Disease Support Group. We're fortunate to be joined by two experts tonight, Dr. Candice Royal, a pediatrician and allergy specialist, and Dr. Suretha Kannenberg, a dermatologist who works extensively with complex and chronic skin conditions. Let's dive straight in. Candice, let's start with the foundations. Many parents and adults are confused about what eczema really is. They want to know whether it's genetic or if they're born with it, or if it can start later in life. Others wonder about the role stress, vitamin deficiencies, or autoimmune problems play, and also why eczema sometimes disappears for years and then comes back later. Can you help everyone understand what eczema actually is and why it behaves the way it does?
Thank you so much, Lynn, and what an excellent set of questions to kick us off. So really, let's go back to the foundations, understanding what eczema is. So eczema is a chronic skin condition, so that means it's a long-term health problem that affects the skin. And to understand it, we typically use a little analogy of comparing your skin to a brick wall. So if you imagine your skin is the barrier between your body and the external environment, and you can think of it exactly in the way that we think of a brick wall. You've got little skin cells that are like your bricks, and then we've got really important supporting elements that are like your cement between the bricks, and then we've got important structural elements that are like scaffolding, and then we've got this really important oily layer that should be present on our skin to keep the water inside your skin and to keep all the irritants and allergens outside. And when you've got eczema, really the problem is a combination of genetics and immune dysregulation. So your immune system, your defensive system that's gone a little bit astray. And what is the result is that your skin barrier has become dysfunctional. So it's not working well because you've lost some of those supporting structures, some of the cement between the skin cells, and very importantly, that oily layer has been disrupted. So what happens then is that it's very easy for water from your body to be lost into the environment. So your skin becomes very dry. And it's also very easy for the irritating things that are in our environments and the allergens that are present to get into the skin. And that all sets up a process of inflammation. And then unfortunately you get itchy and you scratch your skin, and that further disrupts the skin barrier. So that's really the key elements to understanding what eczema is. So yes, your genetics are incredibly important, but that's not necessarily that your parents had eczema. They may have had asthma or hay fever, and then those conditions that hang out as a family can manifest in a child or even later in your life as eczema. So that's just this problem that we have with the dysregulated immune system. So that's really the cause. It would be great if we could just say, it's something that you eat that causes eczema, but unfortunately it's a much more complex process that's going on. And there are many environmental factors that are at play So I mentioned irritants, so those are things like soaps, chemicals that we're exposed to. Think of your washing powders, um, perfumes, fragrances, heat, sweat. All of those make eczema a lot worse, but they're not the cause. Is it an autoimmune condition? So I mentioned the immune system is involved when you have eczema, but autoimmune means creating antibodies against self, so creating a defense mechanism against self, whereas atopy, atopic dermatitis, eczema, is a process whereby the immune system is dysregulated and causes inflammation towards things it shouldn't be reacting to. So that's the difference. So eczema is not actually an autoimmune condition. A lot of people mention stress. So that's really important because we know that your skin can very much reflect your internal emotional dysregulation, and psychological effects definitely play out and can make eczema worse. But again, it's not a cause. It's an exacerbating factor. It's something that makes your eczema worse. So when you're stressed or when you're ill, your eczema typically gets worse. Vitamins, you mentioned vitamins, Lynn. So yes, there's been a lot of research into vitamins, and could a vitamin deficiency be at play, and could supplementation maybe help people with eczema? So unfortunately, the answer is that there's not much evidence to suggest that would help, or that is the underlying cause. But we do know that a healthy diet, and a diet that's low in additives, so preservatives and colorants and things, is probably a good idea. And having a diverse diet with lots of fresh fruit and vegetables is probably helpful.
Great. Can we start closing up, or do you want to add something more?
No, I think we've probably covered the building blocks of what eczema is.
I think so, yeah.
Just
Thank you,
to end
Candice.
off to say that eczema is a condition that is chronic, it's long term, but it's also a condition that is characterized by having times that it's a lot worse and then times when it's better. So one must expect that, relapses, but then also times of disease remission.
Great. Thank you, Candice. That helps to lay the foundation. Now that we know that what eczema is, let's talk about what makes it flare up. Suretha, one of the biggest worries people have is around flare-ups. Viewers mentioned heat, sweat, clothing, detergents, fragrances, exercise, stress, and even changes in the weather. Some say their skin burns in the sun or flares just from showering. Can you explain why these triggers affect the skin, how they cause flare-ups, and what people can do day to day to reduce them?
Yeah, thank you for the opportunity, Lynn. All of these, or probably, as you said, one of the main issues that I see with my patients very often is the unpredictability of this condition. But we also have to keep in mind that we are talking about people who have, the majority of people will have a very mild eczema, thankfully. There's thankfully just a very small percentage of people that will have the very, very severe eczema that's there all the time. So sometimes you have people who have eczema flares, and then they're completely normal in between. And then they're exposed to, as you said, heat, humidity, dry air. But it's not even just, even if there are snow on the mountain, for example. So if it's really cold, then some people can flare from that as well. It's completely unpredictable because people have different flares, different triggering aspects as well. Stress, definitely why they are very. Stress dries out your skin, we know that. But stress also will make you a little bit more likely to scratch. You will start to get nervous, and you maybe start to scratch, habitual type of scratching, for example. That can also trigger inflammation then, and then get this whole vicious cycle going. we're actually going to talk about how to address treating or managing eczema a little bit later. So I'm not going to talk about it here too much. But there are other things like pollens in the air, for example, that is a problem. I mean, if you live in Cape Town, pollen count is through the roof. If there's a new animal, just even in your environment, that doesn't mean that you need to get rid of your pets. But if there's a new animal, even 6 kilometers down the road, a new horse, then you could actually have a flare from that. And of course, with change of seasons, we have birch pollens and all of those things. House dust mite, how are you going to avoid that? That's in dust. And you can do as much as you can, but you'll always be exposed to house dust mite. You can control your environment maybe to a certain degree, but you can't control wherever you go. And do you want to live in a bubble? If you want to live in a bubble, then I guess, you'll be able to control your flares, by avoiding all types of allergen exposure or all types of triggering of, things that can trigger your eczema. But if you're not going to want to live in a bubble, which the majority of us, I think, we want to try and have as normal a life as possible, and for our kids as well, then we need to do the basic management of eczema. And basic, I hate saying that, because it actually is what the whole management of eczema is based on, and the complete ground rules of actually managing eczema. One more thing that I wanted to mention is that cigarette smoke actually triggers flares as well. And that's even secondary exposure. So if mom or dad smokes in the house, then child can flare from that. And that made me think about vaping. So I wondered, now that vaping is the craze, does that affect it? We don't know yet. Why? Because we are the lab rats of vapes at the moment. 20 years down the line, maybe we'll know if those vapors also trigger flares. Stress, how are you going to avoid that? You can try and mindfulness exercises, those type of things. Definitely it plays a role. Getting psychological help as well plays a role, but it is, in the end, we need to look at the cornerstone, or the basis of the management of eczema, and that we will be discussing a little bit later.
Great. Thanks, Suretha. I often fondly remember my mom saying that all we need to do is put me in a bubble. And she was always hopeful that we would find a bubble that would control my eczema, but I was never lucky enough to get that. Anyway, thank you so much for that. Moving on, many families also struggle to recognize eczema when it first starts. So let's move into how we diagnose it. Candice, many parents struggle to tell whether a rash is eczema, ringworm, an allergic reaction, or something else. Others are unsure about scalp eczema, private area eczema, or dark marks. Can you talk us through how eczema is diagnosed in babies and children, what signs to look for, and when parents should consider allergy testing or seeing a specialist?
Thank you for that question. So the first thing to say is that eczema can look different in different phases and at different ages, and it's what we call morphology, what it looks like, and its distribution, which areas it affects, can change in the same person over the course of their lifetime. So that can be a little bit more challenging to recognize. But the one thing to say is that if it's eczema, it's going to be itchy. So if it's not itchy, it's not eczema. So that's a really key message to remember. In small babies, eczema often starts off looking very red. It can be weepy and oozy. So we call it acute eczema. So it can start off looking quite angry. The skin can be even a little bit swollen. And it typically starts on your cheeks in small babies, but can affect the whole body. So that's a rash that one should recognize as potentially being eczema, a very red, angry, itchy rash that maybe looks a bit weepy. And in eczema, unlike an allergic reaction, it's going to be a little bit more fixed. So yes, it will get worse and better, but it's not going to disappear as quickly as an allergic reaction would. So an allergic reaction would typically gives you more flushing or hives, so little bumpy, pale areas, but you're not going to see that with eczema. Infections, a little bit tricky to distinguish, and often eczema is infected too, so it's probably best to seek a healthcare professional's advice. As we get older, eczema tends to become a little bit more limited to your folds, so your elbows, behind your knees, in the neck, on your ankles, on your wrists, maybe your hands are very typical places where you'll see eczema, and it might look a little more fixed and a little less angry, so more sort of less red and more brown, or maybe even if you have a dark skin, can look quite gray and can get quite flaky, and the skin can become really thick, and you might see a lot of lines in those patches, and that's very typical of eczema. And going into adolescence and adulthood, eczema of your eyelids, around your mouth, of the private areas, and of your hands may emerge, and that again quite troublesome because those are really sensitive areas, so cause a lot of discomfort, but also a little bit more tricky to treat. You mentioned ringworm, so just to say, ringworm can look a lot like eczema, except that ringworm typically has a really well area of affectation, so well circumscribed. So you can see there's a hard line between the abnormal skin and the normal skin, and then in the center typically is quite clear. So you've got a sort of central area that's pale and clear, and then an angry red layer, but a well demarcated area between your normal skin. Other things you mentioned there about marks, dark marks, light marks. So those are unfortunately the complications of not treating eczema. So eczema, when it resolves, can leave light marks, but if you've really scratched it, it can leave dark marks, and those may take time to recover as well. As I said, eczema skin, because of the barrier dysfunction, can become infected more easily than normal skin. So signs to look out for, it would be a sudden worsening of your eczema, pain instead of itch, much more redness, weepiness. Obviously, if there's pus, scaling, that could suggest, or blistering, bloody blisters is a very important sign of a severe infection that one needs to seek urgent healthcare for. Allergy tests, so that's always a contentious aspect. So not all eczema is an allergic basis. So people can have eczema just because of genetics, so they don't always have allergy. But if your eczema is difficult to treat or really diffuse, or it started very early on in life, then looking into allergy tests would be a good idea. But please, just to note, those tests can be difficult to interpret, and they need to be performed by someone who's really confident in practicing allergy with eczema patients. When should you see a specialist? So again, if your eczema is difficult to manage, you're not getting by with conventional therapies, it's causing impact on quality of life, one is worried about an allergy, then it's a good idea to see a specialist, and that could be a dermatologist, pediatrician, a physician, or an allergist. And yeah, all of those are available both in public and in state. And as Lynn mentioned, we have that list of state facilities and specialists available to you in the comments.
Thanks, Candice. Diagnosis is one part, but daily care is where most parents feel overwhelmed. Let's unpack that. Suretha, Everyday care is probably the biggest theme in all the questions we received. People want to know the best way to moisturize, how often to do it, whether aqueous cream is safe, what bath products to use, and why certain products seem to stop working after a while. There are also a lot of questions about detergents, fabric softeners, clothing choices, and how to manage the itching and the scratching. Can you guide us through what a good daily routine would look like and what makes the biggest difference?
I have to say that I think that this is the most important part of managing this chronic condition, because remember, it's not something that we can cure. It's something that we need to manage, and there are very simple things that we can do that can already help our child or ourselves, the eczema, the person with eczema, to make that better already. So I always like to think of it as staying away from the bad stuff and doing the good stuff. So what is bad for your skin? Water is bad for your skin. So it's important to not be spending too much time in the water. So not be spending more than 5 to 10 minutes in the water. And I know that little kids, they tend to want to stay in the bath for half an hour or so, and that's very important to make sure that they're not in the water too long. If you're an adult, you like to take really hot showers because it burns away the itch. Be careful with that, because that will just, if the itch returns, then the itch will inadvertently lead to scratching again. Scratching will lead to more inflammation. Inflammation will lead to more itching, and then more scratching. So that is the cycle that we try to break. So it's important, and then also critically important to stay away from, super bad, is to stay away from soaps that foam. Soaps that foam are definitely one of the main culprits that washes away. Candice was talking about the cement between the cells, the fatty layer that's on the skin, the lovely, nice and oily layer that protects your skin and keeps it nice and healthy. And soap washes that away. And so therefore it's very important to avoid that. But now what do you do? Because now you need to use something to wash the skin with. Okay. So yes, wash, obviously do a quick, exposure to water. So a quick shower, lukewarm or warm, but not hot, 5 to 10 minutes max. And then, and use a soap substitute. So there are various that we can use. And yes, you can even use aqueous cream to wash with. Leaving aqueous cream on as a moisturizer is not advised. We'll talk about that now. But using it as a wash is a nice and a cheap way to also get away with it, because I mean, we all know the cost of living now, don't we? There are other wonderful products that you can use, various costs or prices, various costs, and that you can see on the AFSA seal of approval products as well. Then, if we're out of the bath or shower, pat the skin dry with a soft towel. Don't rub, because if you're going to be rubbing the skin, then it's going to itch more, then you're going to scratch more, and there you go with a bad cycle again. And then within about 3 minutes, then you apply your moisturizer. Now, remember, please, no aqueous cream as a moisturizer, because it actually contains irritants that can irritate your skin. But there are other wonderful products that you can use. So you will see various products on the market that contain cetrimacrolol. Be careful with urea, especially with higher percentages of urea. That can sometimes irritate the skin. Then there are other things like, this is now before we get to medication. This is before we get to seeing your doctor. You can do these things already that can make a massive difference. Oh yes, how many times a day? We said that, very important. If your skin is good, then you need to do it twice a day. And you need to do it all over your body, because not only do you have eczema on the areas that you can see with the naked eye or that's itchy, you actually have that eczema in your whole body, and your whole body needs to be treated, really. So, so we need to. So if skin is good, twice a day. If skin is bad, 3 to 4 times a day. So when you see, oh my goodness, itching is coming back, then you go from twice a day, you increase your moisturizer first, and maybe you add your medications and those things later. We can also do wet wraps. That's also something. There's a lot of information on the Allergy Foundation of South Africa's website on that. And you can do it only using a moisturizer, or you can do it moisturizer with medication as well. And then, of course, we want to make sure that the nails are short so that we don't scratch the clothing. Things like the kitty comb wear things, those things help a lot as well to cover the skin. But also using clothing, loose clothing, cotton clothing, making sure that we don't have the itchy and scratchy, the labels and things on the clothing. Then we were also talking about laundry detergents and those type of things. So fragrance-free stuff. Give your clothing an extra rinse, just to make sure that all of that is out there. Softeners, fabric softeners, generally people recommend that you avoid that. But make sure that whatever you're using is fragrance free, and that you give it an extra rinse. And all of these moisturizers as well, I also want to mention. No colorants, no perfumes. So those are the type of things that you need to look at. I don't know if there's anything that I didn't cover there, Lynn.
No, I think that's wonderful. Thank you so much. Something that also came up again and again is eczema in sensitive areas, and I think you've alluded to that now. But let's focus on that next. Suretha, we received many questions about eczema in sensitive or delicate areas, especially eyelids, mouth, hands, private areas, and people also want to know which sunscreens are safe and why sweating can sting or burn. Could you explain how to safely manage eczema in these more delicate parts of the body, and when to consider adjusting or escalating your treatments?
Okay, so yes, the things that I've just mentioned, moisturizers, and avoiding the bad stuff, doing the good stuff, it applies to all of these areas. Hand eczema is a particularly complicated one to treat, because everything that you are going to your hands will be exposed to everything. So say you only have hand eczema, you don't have eczema on your scalp. Now you're thinking, okay, I can use a normal shampoo, but how are you going to apply it? You're going to be applying it with your hands. So it kind of, if you have hand eczema, for example, you are going to have a whole mind shift of making sure that you use everything that is eczema friendly, whether you have it visible on the rest of your body or not. If we look at eyelids, for example, same moisturizers will apply. The only thing is, if we are going to start to look at medications, for example, then we want to make sure that we're using medications that are safe for these areas. The private areas also, because of sweat and friction, those areas are more prone to getting eczema. In ladies, nipples are also areas that we typically see, especially if they're breastfeeding, for example. We see that they are more prone to getting eczema in those areas. And then it's the same thing applies. The moisturizer and the good skincare applies. Scalp eczema, We do have shampoos that are good for people with eczema, and it's important to. You can also get that information on Allergy Foundation of South Africa's website, the seal of approval products. If we look at the sunscreens, it's important we get two different types of sunscreens. So you get the mineral sunscreens and the chemical sunscreens. So the mineral ones are more the ones that contain zinc and titanium, that just reflects the sun of your skin. And it just really sits on the outside layer of your skin. So those are the better sunscreens to use. And of course, always fragrance free. So that's very important. Now, yes, when do you escalate treatment? Obviously, if your moisturizers aren't enough, then it's time to see a healthcare practitioner, whether you see a dermatologist or whether you go to start off with with a pharmacist is usually the first place that people go, or in government sector will be a clinic, or a healthcare facility will be the first port of call, and they will then suggest medications, for example, various medications. Of course, a pharmacist can give you a very mild topical steroid, but if you need anything more than that, then you're going to need to see a doctor. Where do you see the doctor? You can obviously start with general practitioners as well. But if things get too complicated, then you're going to need to see specialists. And that's when you get to see people such as myself and such as Candice that have specialized in these conditions. Yeah.
Right. Thank you so much, Suretha. That's very helpful. Many of our questions were from parents. So let's shift into how eczema affects children. Candice, parents wrote in with concerns about their babies developing eczema at a very young age, and many are wondering whether formula, dairy, or certain foods play a role. Others want to know whether children will outgrow their eczema and why puberty sometimes makes it worse, and how they can help their kids who are embarrassed or losing confidence. Can you walk us through how eczema presents in children and in the teenage years, and how families can best support their children?
Thank you, sure. So let's start with infants, so babies. So eczema can start out really early in children, and children that start out within the first sort of month or two up to 6 months of life tend to have a more severe course, unfortunately, with their eczema. So it tends to be worse and last and not get better as they get older. Whereas children who develop eczema later tend to do better, and a lot of children who have eczema by the time they enter school have either it's resolved or it's at least a lot more localized to specific areas and easier to treat. Unfortunately, as one enters adolescence, so teenagerhood, and there are hormonal changes that may affect eczema and may bring it back or make it worse again. Let's just touch on formula and food, because that's a really big topic in eczema. So just to get the facts straight, children with eczema are more at risk of a food allergy, whereas foods are a very uncommon cause of eczema. As I said when I answered the first question, eczema is very much genetics and a disordered immune response. It's in almost all cases, it's not caused by the food. And if you think about your baby with eczema, you can probably trace the eczema started before you started introducing foods. Anyway, so that and if you take away the food, the eczema doesn't get better. So that just to clear that up, children with eczema, especially early onset eczema, are at risk of having a food allergy, but it's not the food that causes the eczema, it's the other way around. And elimination diets are not good things to do unsupervised. So if you do really think a food is a trigger in your child's eczema, it's very important to discuss that with your healthcare professional and to do an elimination diet after adequate testing and with supervision to make sure that your child's nutritional health is supported. Yeah, so I think that speaks to foods and elimination. Probiotics is another question that we get asked quite often. There's data to say good and there's data to say bad. So at this moment, we don't specifically recommend probiotics for treatment of eczema, rather focus on the skin, putting the good stuff on and keeping the bad stuff out. That's the best thing one can do for eczema. Gut health is another topic that's often comes up when one's talking about eczema treatment. And yes, we're very aware that your skin's health in terms of what bacteria are colonized there is really important in eczema. But gut health, not so much in terms of, you just need to eat good, healthy food. It's not a bad thing to have fermented foods. Yeah, that's really all I can say about that, because that's what the literature tells us. Specific parasite cleanses and food avoidance without good reason is not recommended. It's actually strongly advised against. When should one do allergy tests? So I've mentioned that food is not the cause of eczema in most patients, but like I said, children with early onset eczema may be at risk of having a food allergy. So if your baby did have very early onset, especially severe eczema, it may be a good idea to test before starting introduction of foods to avoid a severe reaction because your child is more at risk. But routinely, we do not do food allergy tests for people with eczema because it's not the cause.
Okay, great. Thank you so much. That clears up a lot of the myths around diet and nutrition. Now, many families also want to know what to do next when the creams and the home care isn't enough. Suretha, many viewers feel that they've tried everything and they're still stuck. They want to understand when to use topical steroids, which non-steroid creams are safe, how to treat oozing or bleeding eczema, and what can help with post-eczema dark marks. Others want to know when it's time to move beyond creams and consider treatments like phototherapy, systemic medications, or biologics. Can you walk us through the full treatment ladder and how doctors decide when to escalate?
Yeah, this is actually quite a tricky one that you're talking about now, I think. But let's just say the majority, remember, as I said earlier, the majority of patients will have mild eczema. And so for the majority of eczema, the basic skincare or the baseline, staying away from the bad stuff, doing the good stuff, that's going to be the most important part of your treatment. Then if you start to see that there's a little spot that's itching a little bit, the child is starting to scratch there a little bit, or it's red, it's starting to get a little bit inflamed there, that's when you apply a little bit of a topical steroid. And there is we have a fingertip unit rule as well. That's also on the Allergy Foundation of South Africa's website if you want to have a look at that, if you need a bit of guidance on how much to apply. So yes, that's the topical steroid. Now, the doctor will generally recommend and prescribe a topical steroid to start off with. And that is going to be your most cost-effective way of also managing your eczema in the beginning. The idea is to always do the good stuff, stay away from the bad stuff, and then when you do have a flare, then you go in and you treat the eczema and you get it under control, and then you stop your topical steroid. So you should not be using a topical steroid constantly. If you are using a topical steroid or cortisone cream constantly, that means your eczema is not under control. And that is when you need to see a specialist. Okay. And that's when when your doctor will also start discussing things like phototherapy, etc., etc. The non-cortisone creams, yes, we do have 3 in the country. That is, well, 2 classes, but 3 in the country. They are quite pricey, but they do work very well, although they are not strong enough to control severe eczema. They're not strong enough to control acute eczema. So when it's very angry, when your eczema is very angry, it's not enough. And you do need a cortisone cream just to get it under control. Over treating with cortisone is bad. Under treating with cortisone is just as bad, because all of that inflammation that is in your skin, it goes over into your bloodstream as well and affects the rest of your body as well. Well, how do you move on to phototherapy, etc.? I think we're going to, we were going to discuss that a little bit later in another question as well, but we can just run through that now. So you and your doctor will decide together, is phototherapy an option? So phototherapy is where we use a very safe spectrum of ultraviolet B to treat the inflammation in the skin. The only thing is, of course, that there are lots of logistics around it, because in Cape Town you may find 10 units, but in the middle of Pofadder, or in Pofadder, or wherever you're living, there may not be one. And so so those logistics. It's very safe, but logistics is the issue. Then, if we've now spoken about if the cortisone is not enough, if the creams are not enough, then you need to discuss with your doctor what medication comes after that. And you get very affordable medications, and then you do get the very expensive medications, which the vast majority of our country, unfortunately, has no access to, whether you have a medical aid or whether you don't have a medical aid. So, but that you discuss with your doctor, and that you will discuss with your specialist. That's not something that a general practitioner will be looking after usually, or the day hospital or the clinic will be looking after. That's when you get to the specialists.
Okay, thank you so much, Suretha. We also had a huge number of conflicting tips and tricks from the public. So let's address some of the common myths. Candice, misinformation comes up a lot. People hear that probiotics and parasite cleansers can fix eczema, or that children will outgrow it, or that steroids are harmful. Some are told eczema is caused by poor hygiene and that it's contagious. Could you help us debunk the biggest myths and explain what families should rely on or not rely on?
Sure. So I think that eczema is probably one of the conditions that has the most misinformation clouding it, and it's really important that we get the facts straight. I think I've addressed that parasite cleansers really have no place. There are also a lot of allergy tests that are not found in evidence that are out there, like the IgG testing, the hair testing. And there's a really expensive test that will probably come back with a whole lot of foods that you need to eliminate, which no one can actually do. And so then your eczema never gets better because you didn't follow the treatment plan, but actually those were just bogus tests in the first place. So that's another thing to just, if you're going to do testing, make sure you're doing evidence-based, approved testing that is going to actually give you answers. Unnecessary food allergy testing, even the food tests that we use that are evidence-based, are largely not necessary in people with eczema. Probiotics I've also addressed, and probably no role, unfortunately, but maybe in the future we'll see probiotics that are helpful. Outgrowing eczema, yes, many kids do outgrow eczema, and I always say to parents, your first year with an infant with eczema is probably your worst year, because they have the more acute, diffuse form of it, and it's going to get better in most cases, and it's going to become at least more limited if it doesn't resolve completely. Unfortunately, there are a minority of people who don't experience that and do have severe eczema that remains with them for their lives. But as Suretha has mentioned, you need to get specialist care in those circumstances. Eczema is not a contagious condition, although eczema skin does get infected more easily. Eczema itself is not an infection, it's a genetic inflammatory condition, so there's no risk of passing it on to other people, but obviously sometimes it can look a little bit scary, and that's why we need to give people adequate treatment. And that speaks to your point about being worried about using steroids. It's not fair to people to not treat their eczema adequately because we're scared of steroids. Steroids are good for eczema when it's needed, when it's angry and itchy and looks is a cause of social embarrassment. Those people need to be treated adequately. Then that may need steroids, it may need other non-inflammatory creams, or it may need systemic therapy, and that's your doctor can help you navigate that. But skin that is itchy and inflamed is being damaged in itself, so it needs treatment. And steroids used with the correct guidance and the correct amounts for the correct places is a good thing. Obviously, we're all aware of steroid withdrawal syndrome, and I think there's a lot of social media chat around that. But that really happens when one uses steroids continuously, more potent steroids, and without guidance. So really see the correct, if you're needing that much steroid, you need to see a specialist who's familiar with managing moderate to severe eczema in the long term, so one can avoid that. And it's certainly not a case of poor hygiene. If anything, soap and water makes it worse. So yeah, that's definitely not the case.
Great. Thank you, Candice. We are running a little bit behind time, so let's see where we can make up some time. Before we wrap up, we want to honor some of the more complex and emotional questions that families shared. Suretha, before we close, we had many heartfelt questions from families dealing with more complex situations. Toddlers who scratch until they bleed, teens with confidence issues, elderly parents with worsening eczema, and people living in rural areas with limited access to specialists. Others are worried about developments in babies, sleep interruptions, or flare-ups in the heat. Can you offer guidance for those dealing with severe or difficult cases who feel that they've reached the end of the road?
Well, I think we've been discussing that most of this evening. So the most important thing is to be looking at your basic management, and then get help from the right healthcare practitioner. Starting off with your GP, for example, or your clinic, for example, and then being referred up to specialist levels. Now we have dermatology clinics and we have allergy clinics in big units, like in Cape Town, in Red Cross, we have an allergy clinic. At Tygerberg Hospital, we have allergy clinic. We have we have a dermatology clinic. So we and then of course in Grootske they have dermatology clinic for adults as well. This is now Cape Town. Can't speak for the rest of the country, unfortunately, but it is on the Allergy Foundation of South Africa's website. But it is important to make sure that you get help for that, because this is a condition that affects quality of life, not only for the patient, but also for the caregiver. And even if you're looking at a family, even the children who don't have eczema will have quality of life. They will be affected. Their quality of life will be affected negatively. So it's important to treat it and not just let it be, and take your eczema management in your own hands, and make sure that you get the help that you need. Sleep disruption from the itch, the best way to treat that or to manage that is to treat your eczema properly. And so that's important. Sometimes we give an antihistamine just to help them sleep a little bit. And I do believe that people who sleep better can deal with their eczema better the next day. But that is not the answer. The answer is treating the eczema. And then referring to specialists, we've been discussing that all evening as well. But yes, if you can just get the right help, if you can see the right doctor, if you can see someone who has a passion for eczema, for example, and you can just, because doctors unfortunately have a limited amount of time that they can spend with you. So, but if you can just find the right doctor, then you're, if you can just get on the right track, then it can be managed. Can't be cured, but it can be managed.
Thank you, Suretha. Before we finish, we're excited to announce that the 3 randomly selected winners from all the questions, we've got their details. We know who you are. They've each won 1,000 Rand, and we'll be contacting them directly on Facebook to get their details. Let's look at the winning questions. So, Dr. Suretha, Princess Princey Malopi asks, for patients who don't respond well to topical steroids, what advanced treatment options are available, and how do you decide between biologics, phototherapy, or systemic medications?
So now we've now done all the good stuff and stayed away from the bad stuff. We have treated with our cortisone cream. We're seeing that, oh my gosh, we need the cortisone cream all over our bodies. So more than 10% of our body surface area is affected. Or we have someone who needs the cortisone cream all the time. Then obviously that's not ideal. We need to step up treatment. That is when you see a specialist, because that is where you're going to need guidance on that. Phototherapy, we've spoken about that. That's a wonderful option, but it is only available in certain areas, and then you need to go for that twice a week as well. So it can be costly, and then it's all the logistics around it, having to get to the unit, etc., etc. But it's a wonderful option. Not in those who actually get worse with sun exposure, though. But it is a wonderful option. Then the next step in our algorithm in our country would be to go for systemic medications. So would be to go for the traditional anti-inflammatory medications that the more affordable ones, and those are the ones that we use in government sector quite a lot. And in private practice, don't think that in private practice we don't use those medications, because they are highly effective. Then if we look at biologics, and JAK inhibitors, all of those fancy new medicines, they are absolutely wonderful, but they are, in the vast majority of people, completely unaffordable. But it is an option if you get to that point. So yes, thank you for that question.
Great, thanks, Suretha. Dr. Candice Preya Naidu asks, a lot of experts indicate that eczema is caused by poor gut health and that a good probiotic or parasite cleanse can eradicate it. Is there any truth to this? I think you've answered this, but you can just quickly, in 2 minutes or even less, possibly just debunk that.
So the answer is no. And I would just maybe say, the Allergy Foundation is made to help distribute good evidence-based knowledge and care, but also to put you in contact with the right information. So maybe just check your sources, because there's so much misinformation out there about eczema. So yeah, look for places like AFSA that are out there to bring you the correct information, to avoid you indulging in non-evidence-based practices.
Great. Now, Candice again. Last but not least, there's a great question from Rika Labuskachny. Her son has had eczema since he was a baby. He's now 15 and it's embarrassing for him to swim with his friends. Do children ever outgrow eczema, and which daily creams can be used that won't harm his skin? She's also concerned because she has vitiligo. Is there a connection?
Okay, great. I think we've answered quite a lot of this. So your son obviously has more difficult eczema, that it's lasted into the teens. He shouldn't be embarrassed about swimming. If there's a rash that's causing embarrassment, it means the eczema is not treated correctly. So as Suretha says, make sure the basics are in place. The good stuff, a good moisturizer that's giving a lot of oil and sealing in water into the skin, avoiding any of the bad stuff. If that's not sufficient to control it, then we need to probably add either a topical steroid or another type of anti-inflammatory. If he's already using all of that, then consider seeking specialist care, because we don't want our teenagers to be embarrassed and being limited. That's not quality of life. Regarding the vitiligo, they're not connected. Vitiligo is an autoimmune condition, whereas eczema is atopic dermatitis. It's a dysregulation of an immune system, but in a different direction. So no connection, don't worry.
Great, thank you, Candice. That brings us to the end of our main questions. Thank you so much to everybody that joined us tonight. Special thank you to Dr. Candice and Dr. Suretha for sharing such clear, practical guidance on eczema. It can feel overwhelming, but you're not alone. And with the right information and support, it can be managed, as we've said this evening. Please keep sharing your questions with us on our support groups. Follow us, look at the AFSA website, and remember that reliable information is your strongest tool. Have a wonderful evening, everybody, and take care.